What is Medigap? Also known as a Medicare supplement. We are going to be doing a little bit of a deep dive today to find out exactly what that is. Hi, my name is Jo Hutchison. I am an independent health and Medicare advisor with Founders Life and Health here in beautiful St. Louis, Missouri. And today we are going to be talking about Medigap and Medicare supplements, which are the same thing. So what is Medigap? Medigap is a supplemental insurance policy that is designed to fill in the holes that are created by Medicare Parts A and Part B. Medigap plans are sold by private insurance companies. So it is not something that's run by the government. It's an additional policy that is run by a private insurance company that will help pay for the additional deductibles, copays, and coinsurance that are left open by your Parts A and B. To understand why a Medigap or Medicare supplement policy could be really important, we have to talk a little bit about the holes that are left open by Medicare Parts A and Part B. Just as an example, for Medicare Part A, which is your hospital coverage, the deductible for 2021 is $1,484, which means if you go to the hospital and you are there from 1 to 60 days, you have to pay the deductible, which is $1,484. If you are in the hospital for 61 to 90 days, your personal daily coinsurance is $371 daily. If you are there for more than 90 days, your daily coinsurance is $742 per day. As far as your Part B, which is going to be your doctor's visits and testing, the cost to you is going to be lumped into several categories, which is going to be your deductible, it's going to be your coinsurance, and it's going to be your copayments. Medicare Part B is going to pay 80% of those costs, which means the other 20% of all of that, including testing, for example, or treatments if you have chemo, all of that extra 20% is on you. And there is no cap to that, which can be a little bit scary when you have situations that you do need treatment for something. So in a nutshell, that Medigap policy or Medicare supplement policy is going to pick up all those expenses, all of those hospital expenses for your Part A, all of the additional 20% for your Part B. So what are the pros to a Medigap or Medicare supplement policy? Well, the first pro, most of my clients like the most, is that there are no networks. So if you are a snowbird or if you travel quite a bit, you're not going to be stuck with just using your in-network doctor where you live. Any doctor that works with Medicare, you will be able to see with a Medigap policy. Another pro to a Medigap policy is depending on the type of letter plan that you have. For example, with a Plan G, which is 100% coverage, you are going to be covered completely for all of the additional costs. The only thing that you will have is your monthly premium. This can really help as far as making sure that you don't have any surprises or unexpected healthcare costs. Another pro to a Medigap policy is that there is no annual enrollment period. That being said, that leads me right into what one of the cons of a Medigap policy could be, is that the time to enroll for a Medigap policy without underwriting is only when you are initially turning 65 or if you are just taking Part B for the first time. So as a con, that means that if you are going to apply for a Medicare supplement policy, but you have already been on a Medicare Advantage policy or just taken original Medicare Parts A and B, you will be subject to underwriting. So if you have some health issues, it is going to be harder for you to get that policy. It'll also be probably more expensive for you to get that policy than during the initial turning 65 or just enrolling for Part B. So along those same lines, as an additional con, as with if you were in a Medicare Advantage plan where during the annual enrollment period you can kind of easily move back and forth between plans based on your needs, that's not really the option with a Medicare supplement or a Medigap plan. Things to remember about Medigap. There are 10 different plans, all different letter plans, and they all vary based on the amount of coverage that they offer and their different costs. So it's important to look at what all those options are. The second thing to remember is that not all carriers carry all 10 plans. So when you are looking at different carriers, if there's a certain plan letter that you are more interested in, you're going to want to make sure that you're looking at only the carriers that carry that plan letter. Thing to remember, number 3, is that all of those letter plans are required to be the same from carrier to carrier. So a Plan G with one certain carrier is going to be the exact same benefits as a Plan G with a different carrier, but it may have a different price. So also important to look at those. The next thing to remember is that a Medigap plan is not going to include your prescription drug coverage. So you're going to have to get an additional plan outside of your Medigap plan to cover your prescriptions. Last thing to remember with the Medigap plan is that most of the time they are not going to include the additional things that a Medicare Advantage plan covers. So your dental, your vision, your over-the-counter drugs, your gym memberships, all those things are going to be included more with the Medicare Advantage plans and not with the Medigap. Whatever you decide to do, make sure that you talk to a Medicare advisor about what the best options are for you, for your lifestyle, and for your budget. Here at Founders Life and Health, we work with Medigap plans and with Medicare Advantage plans. We're happy to help you get pointed in the right direction based on your needs. And our services are at completely no cost to you, so keep that in mind. If you have any other questions, feel free to reach out. Feel free to like, comment, and subscribe down below, and I hope this was helpful.